Good morning, everybody. So I'm very happy to welcome every one of you here to the second day of this Cholangiocarcinoma 2023 conference. We have already heard a lot of moving and inspiring stories between yesterday, and today and this morning already. But we will continue to hear some extra stories, and which continue to be at the base of what the scientists and the clinicians do in their daily life. We will also hear more scientific and clinically focused lectures between today and tomorrow. And I would also like to take this occasion to remind everyone that there are junior investigators posters already hung up in the adjacent room. So please find your time to go there and discuss more science and give your feedback and boost up new collaborations. So now it's my pleasure to invite to the podium Brian Goldshlack. He's a board-certified family physician practicing in Wisconsin for the past 32 years. His practice was composed for primary care medicine, including patients of all ages. This includes well health and preventive care, continuity care for more common diseases, and diagnosis and therapeutic care. And today, he will give a moving talk about when the doctor becomes the patient. Thank you.
Good morning, everybody. I feel very humbled to be sharing the stage with the pioneers who have been instrumental in starting this group. Without them, I don't think we would be individually or en masse as successful as we are. And there's still a long way to go. My name is Brian Goldshlack, and as mentioned, I've been a family physician for 32 years in Wisconsin. And I'm also a patient. I was diagnosed last year with cholangiocarcinoma. One of the things that I have come to appreciate is that in many cases, being a patient in the hospital is sort of like being in an orchestra, and in some cases, there is no conductor. And that would be some of the things that we need to focus in on, and that's what I'm going to touch on today. One of the things to all the budding physicians who are in the audience, I know we have a few medical students, it would be my hope that we would be able to figure out a way to have the students engage in a hospital setting as a patient. Because until that time when you are so vulnerable, you're feeling helpless, there really is no way to know where things are going, and it behooves everybody to understand the process and to take charge so that we aren't just passive observers of what's going on around us. As a healthcare provider, it was my impression that I understood all of this. I understood what my patients were going through with their respective diseases. I'm sure that every primary care provider and specialists hope to understand this. 337 is a special number to me. It represents the number of days since my diagnosis last year in early May of 2022. I had just toned down the practice from a day-to-day practice. I was about to embark on a new journey called transitional care medicine, which is becoming a bridge between those that are coming out of a hospital who have yet to establish with a primary care provider, and there was a huge gap that they would be dismissed from the hospital, and then what? So I would be that individual that would be helping them to find the next step of a provider, keeping their medications going, finding out where they needed to go next. I hope to present the summary of this journey today for the audience, both of healthcare providers and for patients. To the healthcare professionals, please know that it is not my intent to be sitting in a glass house and throwing stones. This is basically an observation of what I learned along the way. One of the first things I noticed when I was diagnosed is I did what I tell every patient to not do. Don't go down the rabbit hole of the internet. Everybody, it seems, according to this diagnosis, every researcher seems to plagiarize themselves. And they say that cholangiocarcinoma is a devastating disease that carries an unexpected survival of only months. I've seen very many people here who have gone well beyond that. And I wish that they would be able to change that opening abstract to their research documents. Early diagnosis is probably one of the main things that is going to be able to help with respect to how well one is going to do with respect to their treatment and then their survival. My diagnosis was established when I was on a transatlantic cruise. I had just retired from my day-to-day practice, and it was supposed to include the cruise. It was going to be 6 weeks across Europe, taking a 300-mile bike ride through the Loire Valley in Bordeaux, and that came to a halting stop. My partner, caregiver, is also an optometrist, and he noticed there were some subtle changes to the color of my eyes, and as we were approaching Dorset, England, he says, you know, there's something I need to tell you, and I'm not sure what the implications are, but your eyes are somewhat yellow. And all of a sudden, all the lights, bells, and everything went off in my brain. It's like, okay, now this makes sense. My urine has been darker. My skin has been itchy. Even before the trip, I had mild elevation of one lab test, alkaline phosphatase, which I did follow up on, but the studies yielded nothing. Even the ultrasound showed nothing. But at that point, I thought, okay, this is more than just nothing. So we were in Dorset, England, and we needed to leave the ship right away because that was an English-speaking community. The next step would have been France. The next step after that would have been Dutch-speaking, and that could have had catastrophic consequences had we stayed on the ship and had to have more emergent treatment, such as removal of the gallbladder. That would have been devastating. After the diagnosis was established in Dorset, we immediately flew back to Milwaukee, Wisconsin, and as many of you would know, the reason for all of those symptoms is that it was a blockage of the common bile duct. So at that point, I learned that I had a Klatskin variant extrahepatic. The stent was placed and things immediately opened up. My jaundice resolved. I thought, boy, that wasn't fun, but ultimately it was something that was definitely necessary. The next step, as everybody here has probably done, we had to get a port placement for chemotherapy. And again, being a physician, I had no idea what was going to happen. And then I started the usual combination of gemcitabine and cisplatin. At this point, I didn't do durvalumab because do not cross-go, do not collect $100. There was an issue of concern that if I did use the biologic that I would take myself off of a transplant list, and there were a lot of reasons that everybody was trying to tell me that you shouldn't do this. Nonetheless, we did investigate all the different transplant programs that we could that were in logical distance to my home in the Green Bay area. What I found was that there was a significant lack of uniformity of the process. The preoperative regimens, the criteria, whether to irradiate or not, it was very different, and it really was troubling to me to not have a clue as to what was going to be the correct way to go. Ultimately, I found out that I was not a candidate, which initially was devastating. Everybody says you got to put all your eggs in that basket. That's the only way you're going to reach cure, and I go beyond that now. Somehow I feel that when this door closes, another 1 or 2 or 3 are going to open, and that's exactly what has happened so far. While I was in the new diagnosis setting and the chemotherapy, I had sepsis, wound up in the hospital, and that was my first inpatient experience of being in a hospital overnight, which actually turned out to be a 2-week stay. That was in combination with ascites because I had gained 30-something pounds of water because of now a newly diagnosed blockage of the portal vein. I'm thinking, boy, this is really falling apart very quickly. So the roller coaster ride had begun. Now, one of the things that I learned is that in a lot of hospitals, things grind to a halt on the weekends. You need a CT scan on the weekend? Nope. You need to have a paracentesis on the weekend? No. These are specialists who deserve their time off. but we have signed up for this. We did sign up to know that we have to be on call and we have to take these emergent processes when they come up. Nonetheless, I was told that I was taking up too many hospital days. And I said, well, how can that be? Because I've been here for so many days of active treatment, but then what happened is that the weekends actually fall into those days. So basically, I felt like I was being set up for failure and then blamed for it, because there was nothing that I could do in order to move things along. I was dumbfounded. While discussing this with some of the staff, I didn't announce that I was a healthcare provider. I was a patient, and I intended to be a patient. I didn't want to pull rank. I didn't want to have anybody feel like they were stepping on glass, walking into the room. Oh my God, it's Dr. Goldshlack. I have to behave differently. That was the farthest thing from what I wanted to have happen. Until one of the hospitalists came in and discussed the word placement. I said, well, what are you implying? And he said, well, placement, we've reached the end of our diagnostic and therapeutic goals here. So at this point, we think we need to have you go into a nursing home. And I said, well, that then means it's the end of diagnoses and therapeutics. And I wasn't done. At that point, I think, now's a good time to let them know what I know and who I am, and say, you know what, can you do me a favor and send a consultation to the interventional radiologist, because I need to speak to them about other options. And there was a hesitancy because they didn't fully understand the pathology. And I insisted on it. I was able to speak to the radiologist who said, and I asked, can you do a stent within the portal vein? He said, yeah, I can do that. Well, I transferred out of this hospital that didn't work on weekends, and I went to a bigger medical center. And that next day, I had the stent placed, and over the next 2 to 3 days, I lost 32 pounds of water. And I felt like I had my life back, because I knew that I couldn't sustain that kind of water accumulation in the abdomen with all the loss of protein and everything else. It was a cascade. So that was one of the first things that started to be the cascade in the opposite direction and moving forward in a good way. Another near miss on the nursing level was when the nurse came in and she had pills, and there was one in particular that I didn't recognize, and I said, could you tell me what that pill is? And she says, oh, it's just what the doctor ordered. I said, well, that's not what I asked you. I want to know what this pill is, how many milligrams, and what's it for? And she had no idea. And I had insisted that she go outside to look at the medical record and come back and tell me what it was. And it was actually in error. They had changed the dosage of my potassium, and it had translated, unfortunately, to a doubling of my potassium supplement, which could have had grave consequences had I taken that pill. So again, I needed to take charge of this and talk to the nursing supervisor and try to set things in a fashion that this wouldn't happen. Again, there didn't seem to be any type of a conductor for this orchestra. So at this point, I was able to be discharged from the hospital. I started to find myself better nutrition, better exercise. I was oxygen dependent. And it was a rough ride, really. And I can't say enough about Gary, my caregiver. I think that without him, I don't know that I would really be here today. The other turning point was Cholangiocarcinoma Foundation. This was something that Gary found while researching the internet. And he says, you need to see this. And we saw that there were other people like me. Because even being a healthcare professional, this was something that I was not very well attuned to. Other people get cancer. I treat people and thinking we're well immune and shielded from the fact that diseases do exist. One of the takeaways that I had learned is that during one of the Zoom calls, there was a concern with respect to the lack of communication between the specialists and the primary care providers. We've talked about anxiety amongst patients, and I was one of them. I'm a patient still, and I have anxiety, but nobody had sent patients back to their primary care provider, making a formal consult. Consults can go both ways. Make a formal consult, specialists, back to your PCP. Let them know what you need and why the patient is going back there. They're depressed. They need to have something to help with the anxiety. There's a whole class of wonderful medications that are out there that can help someone retain their focus and give up a little bit on the natural aspect of what falls ultimately into despair. So that's one of the things that I felt was absolutely missing. So one of the things I don't want to get across is that as a patient, I don't want you to feel like you're so vulnerable now because, oh my God, what is this doctor telling me? The end discussion is that we need to take control of what we are seeing, hearing, and doing in the hospital. We need to be able to write things down. We need to have a pair of eyes and ears beyond our own to be able to hear everything that's going on in the room. And when you're feeling so sick that you can't pick your head up off the pillow, that's where someone else is going to be next to you to be able to take inventory on what's going on around you. That focus is much sharper at that point and will help you possibly avoid some of the pitfalls. And don't be afraid to ask questions. There is no insulting your healthcare provider. There should be none. And if a provider is arrogant enough to that level where they can't take in a simple question, well, first of all, ask the question again until you get your answers. But even on the Zoom call, there was someone who wanted to approach their doctor, and they felt intimidated because the doctor was an arrogant person who threatened to dismiss them because of what they were asking for, and it was just simply a test. So the last thing, how does this impact with respect to the foundation? Way back when I was in medical school, early residency program, came to be aware of patients, some survive more than others. And with respect to cancer, breast cancer was more in the front line at that point, colon cancer, lung cancer, melanoma. And what I observed is that those people who had access to a support group, a mentor group, had a greater than 50% improvement in their overall survival rate as opposed to trying to go it alone. So this is how the magic works. You come into the group, you are the newbie, the new kid on the block. You have no idea what's going on, and there are people waiting with open arms to help you, to give you the insight and the reassurance that is clearly lacking in your mind and soul at this point. Then you move along, you feel like you have recovered some of your sanity and knowledge, and then there are other newbies that are coming in from that area as you move along to the other end of the stage and spectrum where you continue to become now the mentor. So that's where the magic begins. When you are part of the mentoring group and you are part of the support group that is able to answer some of the questions that previously were obscure, you stop suddenly becoming that patient. You become the healer. And that's where you start to heal. That's where the magic actually is going to occur. I can't begin to thank this foundation enough. I don't think I would be standing here right now if it wasn't for a finding on the internet, a magic phone call, talking to Melinda, and having these resources and leads into other areas. So I want to give a very heartfelt thanks to all of the pioneers who have had their impact in starting this wonderful, wonderful organization. There are no words. There really are no words that I can say enough for this. Hopefully everybody will find their way, as I hope to as well, as we all continue on with this journey of healing. Thank you.